So I'm Hammad Jeilani. I'm a doctor by background, a medical doctor. I'm also the co-founder and medical director of Apian. We are a healthcare logistics company, first and foremost. We are not a drone company. We do not build drones. We do not fly drones. And we don't treat the patients, not right now anyway. But what we are instead is a integrator. We are an API. Um, and for us in the UK, but more broadly around the world, we know that healthcare logistics are in a chronic condition. They're slow, they're unreliable, and they are polluting. All three are problems that we need to be solving drastically, because it increases cost, it increases wastage, and it increases our carbon footprint. And we think that it's unfair and wrong that you can get your pizza delivered to your patient in about 15, 20 minutes here in the UK. You can get a bag of bread delivered to you in 10 minutes now, even if you're in a tall story building, but you can't get your healthcare items to be delivered to you quickly, and you can't get your blood tests to turn around very quickly. So in the same way that we enjoy on-demand delivery or near instant delivery in our personal lives, we believe that that should also be the case in our healthcare industry. And we believe that the solution to that is autonomous logistics at national scale. The reason why we think autonomous, let me break that down. So we think the reason why that should be autonomous is because humans make errors. Humans, when they're in control, can make wrong decisions. They can't compute a entire country's information and data in 1 minute. If it's autonomous, it means that you do not have to rely on deliveries that are powered by men and women who can fall sick or who can go on strike or who get unwell, or if COVID happens, who can be told to stay at home. We think that it should happen at national scale because it's only at national scale, it's only at a large scale that drone delivery really becomes an economic viable option. When you're looking at one-off cases of drones delivering one item in one drone from one location to another location, the economics don't quite add up. You need to be able to have a situation where you are moving at scale. You can benefit from the network effects. One drone is carrying multiple items for multiple organizations, healthcare organizations in one go. And you have multiple drones being controlled by one individual, or at least supervised by one individual. At that point, it becomes extremely economically advantageous to use these electric vehicles, because ultimately you will then just have to simply pay for the electricity and the upkeep. I would also like to say that while our focus is to enable on-demand healthcare. So in the same way that you can get your burrito or your naan delivered to you by Deliveroo, you should be able to have your blood packet or your medicine or your anti-tuberculosis medication delivered to you by a drone. And importantly, we are not just a drone. We don't just focus on drones. We are agnostic, meaning that we are happy to work with ground-based couriers, water-based couriers, as we've seen in some of the work that we've done in the Isle of Wight, where hovercraft normally carries medication to the island. We are happy to work with those organizations, those ground couriers, existing couriers, to ensure that the best route is taken. We understand that drones are not the answer to everything, that still vans and other forms of transport are still going to be useful, of course. So we just have to work out how it is going to be integrated into existing logistics. And so we believe that we should be connecting the healthcare and drone industries. As I said, we don't build or fly the drone, just like Uber does not build or drive the car, and just like Deliveroo does not make the food or deliver the food. Instead, these organizations, and just like us, we are an integrator in the middle. We connect a very disjointed and fragmented supply of drones and in the aviation industry to a very disjointed and fragmented demand, which is coming from the healthcare industry, because you have private healthcare, public healthcare, you have hospitals, you have small hospitals, you have warehouses, you have pharmaceutical companies. To coordinate all of these and their specific requests and their specific needs, some will need controlled, to deliver controlled medication, some will need to deliver cold chain medication. Everyone has a different package, different weight, different size. To be able to coordinate that, you need different drones. To have different drones, you need to be able to coordinate with different companies, which means you need to have an integrator in the middle. You cannot just go and say, I will work with one drone company if your country needs 6 different types of drones, because you need some that can fly in the mountains, some that can fly in the Terraki plains. So we are in that middle section, integrating the two industries. So we've done some flying in the past. Last year, we flew some chemotherapy and some prescription in partnership with Boots in the United Kingdom. As you can see, we flew from mainland to the Isle of Wight, which is the most southern section of the United Kingdom, over the water to deliver chemotherapy medication. These were bags of chemotherapy for cancer patients. And this was the drone that we were using. It was a VTOL drone, a vertical takeoff and landing. And there you can see the cytotoxic chemotherapy bag in there. We've also done some academic work looking at the impact of that drone flight on the vibration of that drone flight on these molecules to make sure that they are safe. You'll be pleased to know that we have found that these molecules indeed are safe, even when flown in a drone. Live right now, we actually have some flights going on right now as I speak in Northumbria. We've been going on for about 4 weeks now. We are flying on the northeast coast of England. So as you can see, this is the border with Scotland, and we are flying this red route that you can see between Wansbeck General Hospital, Alnwick Infirmary and Berwick Infirmary, which is a stretch of approximately 80 kilometers. So it's a significant distance in the UK, and it covers one entire county. It covers one entire borough, or one entire district, if you like, the length of it. 80 kilometers we're flying, and we're using the swoop aero that is powered by used by Skyports. So I can show you this is an example of a flight coming into land at one of our sites. It's going to be carrying pathology samples for blood testing. It's going to be carrying chemotherapy for cancer patients, as well as hopefully some blood packs that I will be showing you later. And only after 12 days of flying, we have already completed 98 flights. We've flown over 4,300 kilometers. We've flown over what is essentially 2 whole days non-stop. And the equivalent ground journey that has been removed is equivalent to 2 days worth of ground journey time. And we've removed 614 kilograms of carbon. And we're pushing for around 8 flights a day, 9 flights a day, 10 flights a day. We're hoping by the end of the trial, which ends in May, that we will be flying around 15 flights a day. But in the future, we are working heavily with some organizations around the world and in the UK to be able to deliver 300 flights a day from one central location to the entire north of England. We are very, very medically focused. We are medics ourselves, so we absolutely want to be making sure that our products, our chemotherapy and our pathology samples are kept within their relevant temperature ranges, 2 to 8 degrees for the chemo, 15 to 25 degrees centigrade for the pathology samples. So we developed some custom packaging, as you can see on the right, and we have some PCMs which regulate that temperature inside. And as you can see, the blue lines are perfectly within the bounds of 2 to 8 degrees, for example, for more than 4, 5, 6 hours. We as you can see, from 9 a.m. all the way to 6 p.m. We're also planning, this is not currently yet started, but we are absolutely working on to fly in London. This is very ambitious. It is very complex because London's airspace is incredibly dense, obviously from an urban perspective, from a groundless perspective. So for the aviation regulator, the Civil Aviation Authority, to give us permission, it's obviously much harder for them to do so than it is compared to for flying somewhere extremely rural where there's very low risk to people on the ground. However, the air risk is actually reduced because it is in controlled airspace. Because we are flying within the heart of London, we are flying above the main city, we are flying within the controlled airspace of Heathrow Airport. And so actually the air risk is mitigated because everything is controlled by NATS, which is the National Air Traffic Service provider for the UK. We are hoping that we can start flights by the end of this year, if not early next year. But we will begin by flying between Guy's Hospital, which is here in Southwark, which is right next to the Shard, and St Thomas's, which is right here next to Big Ben and the Houses of Parliament. That is a approximately 3 to 4 minute flight. And we believe that we can have a massive impact on the ability for the trust to deliver pathology samples. So we're working hard on that as well. Not many people believe that this is possible, but we believe it can be done, and we will work with the regulators to make it happen. We've also done some work with NHS Blood and Transplant to deliver blood packs. These include not just whole blood, but we're working on delivering platelets as well. So later on, towards the end of May, we will hopefully be have flown red blood cells, platelets, and we will be publishing a research paper showing that this is absolutely possible, that it's absolutely safe, and some values on the timings and the time saved, because it's obviously very critical to deliver blood quickly. In terms of the economics, many people have done some economics analysis. Every single large consultancy company has said something about the economic benefit of drones. It's undoubted that drones will have an economic benefit. You don't have to pay the drone to do the delivery, while a man in the van, you need to pay for that man. The fuel is cheaper. You know, you're using electricity, which is potentially coming from a renewable source, as opposed to using fuel, which, as we know, can suddenly increase in price when there's a war in Ukraine or war anywhere else. And when has there not been a war? There's always a war. So you're relying on less things and you're able to cut out costs as a result of using drones. However, just like with any new industry, it begins with being quite costly. You know, cars to begin with were very costly. Only the rich could afford them. Flights and flying abroad was very costly, and only the rich could afford to go on holiday or use it by taking planes. But over time, the cost comes massively down to the point where now in the UK, believe it or not, taking a flight from London to Edinburgh is cheaper than taking the train. So as you can imagine, this industry is going to be no different. Drones will become cheaper, far cheaper than humans will ever be. The McKinsey has estimated that if 20 drones can be monitored by one observer, by one person in like an air traffic control fashion, which is happening. So for example, Matanet, which is a Swiss-based drone company, has just been granted Federal Aviation Authority approval by the United States of America to have 20 drones observed by one operator in like an airport style air traffic control fashion. So they've estimated, so this is already happening. Swoopera have had their, Wings have had their, in Ireland have 5-10 drones per operator. So this ratio is getting bigger and bigger. So soon there will be 30 drones per operator. Then there'll be 40 drones per operator as this becomes more and more highly automated, which is where the beauty of this is. So McKinsey has said that if 20 drones can be monitored by one observer, then the package delivery will come down to $1.8, which is equivalent to 5 packages being delivered by electric van by one driver and 100 packages delivered by one driver by electric van as opposed to electric car, sorry. So it's very comparable. Lots of people have done analyses. There have been the Nesta Flying High report in the UK estimated that the basic cost of doing a drone delivery between Guy's and St. Tommy's will end up being 20p, because all you're doing is paying for someone to do the monitoring, which is not a very difficult job, and you're paying for the electricity, 20p. So, you know, and other companies are estimating that it will become, you know, some of the more difficult drone operations will be £20. So these are all becoming extremely comparable, when in the past, you know, these were like 150, 200, 300 pounds per delivery. It was very large. So in the scale of just one and a half years, it's massively reduced. In the scale of another 1.5 years, you will all see that it will massively reduce to pennies, essentially. And that's just because of the very nature of the fact that this is automated, the fact that this uses electricity, the fact that this can scale in a way that humans cannot. Humans in vans cannot scale, but drones can scale because you can just manufacture more of them. However, there's one important thing to mention. None of these studies in the world have so far taken into consideration the secondary effects on human health. Comparing a drone delivering a package to a van delivering a package in a country is not exactly like for like, because the drone can deliver something faster. It can deliver something more reliably. It can deliver something during times when vans cannot. So when there's natural disasters, when there's traffic, when there's whatever there might be blocking the roads, drones don't get blocked by that. And so the Secondary effects of using drones are that you have increased reliability, which means you do not have to stock extra items. You do not have the risk of going out of stock in these rural parts. It means that when there are disasters and your bridges collapse and your roads become covered in landslides and you have flooding in your plains, you can still deliver healthcare to people. You can get your you can get your lab result turned around faster. That means you can get a result faster. That means you can isolate someone with potentially multi-drug resistant TB faster. It means you can then deliver medication to them faster. It means you are more likely for that person to get better faster. That all equates to labor, because that person, if they're ill, cannot work. But if they can work for an extra 4 days because you've delivered their treatment fast, you've diagnosed them faster, that 4 days of labor is saved. It means that you can equate that into an equivalent amount of money, but it also means that they are less likely to fall into poverty as a result of becoming ill because they're the main breadwinner in the house. And the reason I talk about all of these things is because I actually did a case study on Nepal. I am obviously focused on the UK, but actually my heart lies in the developing world. When I first started out, my aim was to support those in countries that were affected by Ebola, for example. So originally Liberia in West Africa. I myself am from Afghanistan. So I have seen how bad that, when you have no infrastructure and your infrastructure is crippled by war, that damages your healthcare. And if your healthcare is damaged, then your labor force, your workforce is damaged. And if your workforce is damaged, you have no proper country. That's exactly the story of my nation. So being inspired by that, I started Apian with 2 co-founders. For now, we're focusing on the UK, but once we have developed the systems, the software, the regulations in the UK, we will be taking this abroad. But I did my dissertation 2 years ago at the London School of Economics at LSE on a review of drone use in healthcare as a systematic review. And then I focused on Nepal and I focused on the DROTS program on DT and if I can you see this? Can someone tell me if they can see this graph? Let me know if you can see this graph. I think you can. Great. So this was my report that I published on Nepal. And I'm very happy to share this. And I go over the economic analysis here, but this is now out of date. So many people come up with economic analysis every year. But in Nepal, you can look at certain things. You can look at the geography, the physiogeographic division of Nepal, how people in the mountains have problems accessing healthcare, but because of course it's mountainous regions. But you have people in the Terai plains who are also having problems accessing healthcare when there's flooding, and when there's landslides and when there's earthquakes. And landslides are only getting worse. Floods are only getting worse. Earthquakes are only getting worse because of the changing in environment and because of climate change. When you add this up all together and you realize that as a nation, this is just my opinion, having done a significant amount of an analysis of all of these things, looking at how many people had access to healthcare facilities, whether they were in the Terai, the Siwalik, the Middle Mountains, the High Mountains, the Himalaya, the access to that healthcare, how long it took for them to access it. This is a seasonal comparison of average travel time for healthcare facilities in the dry season as opposed to the monsoon season. Looking at the correlation between child mortality, maternal anemia, and remoteness, and how that increases. Stockouts, all of these things, you realize that when you combine that with the fact that you've got things like TB, which are only becoming more drug resistant, here's the percentage success rate on the left-hand side. It's been declining from 92% to 89%, which might not seem like a significant amount, but as we know, once a multi-drug resistant strain catches hold somewhere, it is obviously extremely difficult to eradicate and treat. And so that then becomes the norm. So, and also it's not like 36,500 TB cases are the only cases. It's estimated that that's actually 50% higher than expected because we missed 36,500 TB cases every year. And the number of multi-drug resistant TB cases only increasing. And that all has an economic cost. So yes, you are more than allowed to compare a van doing a delivery to a drone doing a delivery. But what you're not comparing is the benefit, the economic benefit as a result of having faster delivery, faster diagnosis, faster treatment, stronger adherence to the treatment, faster recovery for that population. reduced risk of spreading to other people in that population. You can deliver vaccines that you wouldn't normally be able to have your hands on. I read a shocking statistic at the beginning of my endeavor in this, which said that 1 million children under the age of 5 die each year around the world, simply due to a lack of access to already existing pneumonia vaccines. Pneumonia is such a simple disease. We already have vaccines to treat it. We already have antibiotics to treat it. It's all there. You don't need to have like a new cancer medication to suddenly develop, which will cost billions. No, it's already there. The vaccines are there, but we simply cannot get it to the people who need it, who live in the rural areas, who live in the isolated areas, who live in the mountains. As a result, 1 million children under the age of 5 are dying. That has a huge impact on your economic ability as a country to develop. So having studied health and international development, if you want your country to develop, you need to invest in your country's healthcare. Otherwise, your country is sick, you're poor, and dies young, which is of no use to anybody. What kind of labor force do you have? You cannot build anything. You cannot do anything if all of your labor force is young, dying, and sick and recovering. So you need to invest in healthcare. There's a great book I would recommend to anyone who's interested in the cross between healthcare and economic development. It is by, you might be able to see it if I put my face there. It is called The Great Escape by Angus Dayton. And it shows the links between health and wealth. And better health leads to better wealth, and better wealth leads to better health. So I only say all of this because I'm very passionate about it. And it is one day what I want to do. I looked at the case study of the Drots, for example, and all the different kinds of, in the conclusion, I just went over some of the different kinds of benefits that having access to better healthcare, having access to drones in your logistics system, particularly when you have difficult road, you have basically no railway, you don't really have the ability to pay for fancy helicopters, you have to rely on really, really difficult logistics. Drones are an absolute win. I would say that there is probably no other country that needs drones more than Nepal, in my humble opinion. And I'm not even Nepalese, I'm from Afghanistan. So whoever's listening, I would recommend that you absolutely take this very seriously. That you work with organizations like the Flying Labs, who I have much respect for, with Village Reach, who I have a lot of respect for. And one day, people like us, who are absolutely trying to make it a situation where you have easy access to any and every drone operator, because some drones can carry things further, some can carry things heavier, some can carry things cold chain, some drones can carry things that are just more sensitive, that cannot be subject to shocks and vibrations, that need to be carried a bit more sensibly, because they're made of glass, for example, whatever. So thank you. I'm very happy to take any questions, and feel free to ask me anything or contact me later on. I can't hear anyone, by the way. So if you do have questions.
Thank you, Hammad.
Oh, there you go. Now I can hear you.
Thank you, Hammad. Thank you for your wonderful presentations and giving your valuable time to us. So we are running out of the time, so we only take 3 questions from the audience. Anyone here? Yeah.
Dr. Jeilani, if I pronounce your name correctly, I'm Dr. Maski from University and Nepal Academy of Science and Technology. I'm just interested in your, you are just managing the drone for healthcare purpose, not flying, not development, nothing you do, just making linkage between the need and the supply, right?
Absolutely.
What kind of procedural, you have to take the license, or how do you function like that? Without having any permission, also doing very long distance, supply of the things, and you are not doing, but somebody does it for you.
Yes.
Yeah, please a little bit highlight that one.
Expand. So I should say, to be absolutely clear, we do have full Civil Aviation Authority approval to fly for our drone operators that we're working with to fly in Northumbria, for example, and in London, Again, the reason why it's taking up to a year and a half, is because we are going to be working with the Civil Aviation Authority. The drone operator will be submitting their operational safety case that determines exactly what they will do, how they will fly, what are the contingency, what are the risks, what are the mitigations, the skill set of the pilots, how the pilots will be operating, the technical information around the drone, but then also the risk assessment at the end. All of this is compiled into a multi-100-page document, often 200 pages, 250 pages, and that is then taken by the regulator to be analyzed, and the regulator will only accept, if it meets a very high bar of safety. They are not going to let these drones fly without having met that bar, just like you can't get the license to drive without having met a certain bar. The Civil Aviation Authority does exactly the same thing, but for drones. So we are getting those licenses. I say we, the people we are working with, that we're helping, are getting those licenses. I will just add one more thing, which is we are not simply connecting the healthcare use case to the right drone operator and drone provider. We are doing the integration in the middle. So once the drone lands, who goes and collects the sample? Is it the porter? How does the porter know which drone to collect the sample from? How does the porter know which drone to put the package in? How does the porter know when the sample is coming? Are they going to get notified on their phone? How does the porter know that the right package is going in the right location? Or if the drone is carrying multiple packages, which one to take out? Where does it land? Is there a secondary landing site? There's a lot of considerations that drone operators don't focus on. This middle management in the hospital environment that we focus on. That's the integration management that we do. And the software. So, if you're a healthcare facility, how do you order the drone? How do you track the drone? How do you bill the drone? Where's the billing? Where's the money flow? All of these kind of integrated systems needs to be developed, and they are not yet developed because nobody's focusing on it. Drone companies focus, rightly so, on their drone technology. Pilots focus on their ability to fly, and then the healthcare people focus on providing healthcare. We are in that middle, helping to integrate the two. And that's why we've done a decent amount of work so far, but we've also got a lot more work to be done in this space. It's just like Uber, and just like Deliveroo, but for healthcare and drones.
Thank you. I appreciate very much your work in Nepal, your research work. And you already done the doctoral thesis. I think they're taking the data from Nepal. What do you suggest, your recommendation for Nepal is to have such kind of a service facility like you are doing in your country?
Absolutely. If look, I'll be very blunt. The first world, the developed world, the UK, these organizations can live absolutely fine with the current drone logistics, current ground logistics. Having drones is only going to increase the productivity. It's only going to make things better for patients. That's absolutely true. But the countries that really need it are the countries with very difficult logistics. It's countries like my country in Afghanistan. It's countries in Africa. It's countries in Southeast Asia that do not have road networks, do not have railway networks, don't have the most amazing public transport for people, that have difficulties associated with climate change, with landslides, with earthquakes, with flooding, lack of access to healthcare. You've got blindingly obvious statistics telling you that when there's a monsoon season, the access to people's healthcare goes massively down. You've got to look at ways of delivering healthcare to that remote villages in the mountains or in the into the plains. Of course, I think you should be looking at that. That is my personal opinion. And I think the benefit is going to be far greater for a country like Nepal than it is going to be for the UK. For the UK, it's the equivalent of going from 95% to 97%. Do you see what I'm saying? Like, it's still great, it's still good, but the difference is, it's that much. The difference to people like Nepal, the difference to people in Afghanistan is huge. It's the difference between dying and living because of access to a vaccine. It's the difference between going blind because of having, a river blindness or a tropical disease and not being blind. And once you're blind, you're a burden on society from an economic perspective. That's how the health economists view you. Once you're blind and you can't work, you can no longer produce labor. That's how the health economists view you. So if you want your country to be healthy and productive and to develop as a nation, you need to invest in the healthcare. And the critical thing is when you read these books and you do the research and all of this stuff, you realize that the reason why countries are not so heavily investing in these things is because the immediate reward is not easy to see. It's the reason why people don't invest in their health insurance. You know, in Africa, for example, I was studying, because they are very short-sighted. You know, why should I invest in my health insurance when, you know, I could be killed by a war tomorrow? So they don't bother investing. But that's the wrong way to think. You have to invest in your healthcare. The benefits of investing in your healthcare are long-term, not quick. Some of them are going to be short-term, absolutely. You get quicker diagnosis, quicker treatment. But the benefits come longer. The other reason why people don't necessarily invest in healthcare that needs to be talked about is that if you save someone, if someone gets ill and you give them antibiotics, they get better, right? But as a result of that, they think, oh, you know, like I'm still alive. They don't think it's a big deal. People only realize health is a big deal when they become blind, when they become ill and they can't work anymore. At that point, they realize, oh, it's a big deal. Until then, people are very, you know, optimistic. They don't think that they will get ill. They don't think that they will get problems. They don't think that they will die. So people need to realize that their health is very important. The stats around multi-drug resistant TB, the stats around these things are scary, if I'm honest. You know, we saw how COVID spread. You know, it's not inconceivable that things like multi-drug resistance can spread very rapidly if it takes foothold in a country. As far as I understand it, that is also some of the top priorities of the organizations like Bill and Melinda Gates Foundation. So there's clearly going to be funding in this space for a country to develop its resilience against things like this, because there are organizations that are willing to fund it. So I definitely would recommend that Nepal looks at this very seriously and consider investing in this.
Maybe I will have another question after Dr. Ramesh. Hi, this is Vikas. I'm president of Robotics Association of Nepal. I know the DROTS project has been here in Nepal since long, and I saw that in your presentation. I just wanted to know your more engagement on DROTS project, and I also wanted to know how sustainable this project is. If someone wants to work on this and make it as a business, what do you think is the possibility?
It's a very, 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 very good question. So first of all, I wasn't very involved in the DROTS project. All I did was receive the information and then I did an analysis. That's all I did. I was never involved. I would love to get involved, but I was not. In terms of the business model, Nepal has a massive advantage compared to countries like the UK, the US, where drones are flying, because the UK and the US has extremely restrictive, extremely difficult and challenging regulations to overcome and to pass. When you look at a country like Rwanda, when you look at a country like Ghana, when you look at countries like Kenya, they are far ahead of the developed world. They have completely leapfrogged. They are already delivering thousands of units of blood. They are delivering thousands of vials of vaccines already. We can't, we're not. That's putting us to shame. But the reason is because the government in Rwanda has said, okay, we are going to make this happen. We are going to ensure that the drone operations can happen. The airspace, we will make sure is safely deconflicted, because you are able to make such a decision. In the UK, the government can't just suddenly go, okay, everybody get out of the way of the air. You know, everyone will start protesting, etc. It's much more challenging for a country that has already a deeply embedded aviation community, from a general aviation, international aviation, to make such a change. But countries that do not have such developed aviation airspaces that are full of people flying around have a perfect advantage. You have such a good advantage. You must look at Rwanda and learn from Rwanda. Now, Rwanda has decided to go and work with one massive drone company, basically Zipline, and that's absolutely fine. My recommendation would be that you look at that, and you also look at the option of working with multiple different drone companies that will give you the ability to fly in different locations, because of course Rwanda is very different to Nepal. Rwanda does not have the highest mountain range in the world, you know, so delivering to mountains is going to be slightly more challenging than using the drones that Zipline has.